Hello everyone. So in this video we are going to discuss about the lesions in the dermatology. So first we are going to do the primary lesions. So lesions in dermatology, and first we are going to do the primary lesions. So in the primary lesions, basically there are six types of lesions, six types of primary lesions. So the first lesions were the non-palpable skin lesions. So first one is the non-palpable skin lesions, means we cannot palpate the lesions. So non-palpable skin lesions. So in this we have less than 1 centimeter and more than 1 centimeter. In this we have less than 1 centimeter or more than 1 centimeter non-palpable skin lesions. So less than 1 centimeter were known as macule, while the more than 1 centimeter were known as the patch. So as in this image, I will show you less than 1 centimeter. Suppose this one, these one. So these were the less than 1 centimeter. That's why they were macule. While these were the more than 1 centimeter. So these were the patch. These were the patch because they are not palpable. We cannot palpate them. So these were the first category of the primary lesions, in which we cover the non-palpable skin lesion. And in this we have the macule and the patch. Less than 1 centimeter macule, more than 1 centimeter is patch. Now move to the second lesions. So second type of lesions, in this we cover the raised solid lesions, means they were circumscribed, raised and solid lesions, means they were raised and solid lesions. So in this also we have the less than 1 centimeter, more than 1 centimeter and more than 1 centimeter, plus they have the depth also. The lesions have depth also. So in this we have three types: circumscribed, raised and solid lesions. We have three types: less than 1 centimeter, more than 1 centimeter, plus more than 1 centimeter, and the lesions have depth also. So the less than 1 centimeter is known as, when the lesions is raised, means we can palpate it and it is a solid type. So more than less than 1 centimeter is papule. So that is papule. More than 1 centimeter is plaque, and more than 1 centimeter plus the lesions have depth, it includes the nodule. So as in the image, so these were the papules because they are raised from the skin surface, means they are raised above, and they were less than 1 centimeter. These were less than 1 centimeter, so they were papule. If they were more than 1 centimeter, as we see here, it was more than 1 centimeter and it is raised above the skin and it is solid type, so it is a plaque. While the nodule is in the depth also present, that is, and it is more than 1 centimeter, so it is a nodule. So it is the second category of the normal lesions of the circumscribed, raised, solid lesions. In this we cover the papule, plaque and the nodules. Now next move to the third type. The third type is the clear fluid filled lesions, means in this the lesions is filled with the clear fluid. So the third type is clear fluid filled lesions. So in this we have less than 1 centimeter and more than 1 centimeter. So the lesions is filled with clear fluid. So less than 1 centimeter is known as vesicle. While the more than 1 centimeter is known as bulle. So in this the lesions is filled with fluid, and the fluid is clear fluid. It is less than 1, more than 1. Less than 1 is vesicle. As we see here, these were the vesicles, because as we see here that these were filled with fluid. So these were less than 1 centimeter is known as vesicle. If they were more than 1 centimeter like this, then they were bulle. Now move to the fourth category, and the fourth category include the pus filled lesion, means the lesions were not filled with clear fluid, they were filled with pus. So pus filled lesions. So in this we have the small pinpoint lesion, pinpoint lesion, and the other is larger deep collection of the pus filled. The pus is filled and the lesions is large and deeper collection, large deeper collection. So in the pus filled small fluid filled space, small pinpoint lesions, the is known as pustule, while the large deeper collection of the fluid pus filled is known as the, as we see here, it is abscess. So when they are filled with pus, we have pustule and abscess. This is a fourth type of the lesions, of the primary lesions. Now next is the fifth type. So in the fifth type we have the RBC extravasation. So in this what we study, so in RBC extravasation, it is either on the skin or on the mucous membrane. So what will happen, the lesion, if the RBC extravasation is between 1 to 2 mm in range, then it is known as petechiae. If they were more than equal to 3 mm, then they were known as purpura. While if they were 1 to 2 centimeter, here the range is in the centimeter, while here it is in millimeter. So 1 to 2 millimeter is petechiae, more than equal to 3 mm is purpura, while more than 1 to 2 centimeter is ecchymosis. So as we see here in the images, so these were 1 to 2 mm. So these were the petechiae, while in this image as we see here that these were the petechiae, and here it is more than, it is around 3 mm, so it is a purpura. Well, in the ecchymosis as we see here, it is a ecchymosis and it is 1 to 2 centimeter. In the range. So this is a fifth type RBC extravasation of the primary lesion. Now the sixth type of the lesions of the primary lesion is the sixth type. So sixth type primary lesion is a wheal form. So in the wheal form, what we know, so wheal is a edematous, means edema is present. So it is a edematous area and it is evanescent plaque. It is a evanescent plaque. And in how we identify it that it is a wheal, so in the wheal what we find that it is in the center it is pallor. So central is the pallor area, and peripheral is erythema. So central is the pallor area, while the periphery is the erythema area. Periphery is, it is reddish in color, while the center is pale in color. And the example of wheal is, so example of wheal is urticaria. So and the other also definition we also have the for wheal. So wheal we have, it is itchy, edematous and erythematous evanescent plaque which come again and it disappear also. So it is a wheal. So in the wheal, the example is urticaria. As we see here, the central area is paler, while the periphery is erythematous. Periphery is erythematous. So it is a sixth type of the primary lesion. So wheal. So these all about the primary lesions. So in the primary lesions we cover here the first one, that were the non-palpable skin lesions, in which we cover macule and patch. When the circumscribed raised solid lesion is there, in this we study papule, plaque and nodule. Clear fluid filled were vesicle and bullae. Pus filled lesions were the pustule and the abscess, and the erythematous RBC extravasations were petechiae, purpura and ecchymosis. And the wheal, that is the example of urticaria. So I hope you get benefit of this video. Thank you guys. Bye bye.